Hello everyone, Dr. Suneel, Dhand, internal medicine physician. Welcome to another video. I've made a fair number of videos over the last few months regarding the very troubling data and statistics we are seeing with the rise in number of people suffering heart attacks, heart disease going up. But I want to share with you another recent piece of data and an article that really puts into perspective the tragedy we are witnessing in terms of number of people affected every single day. Take a look at this. So this data is from the United Kingdom, published in the Telegraph very recently. Heart deaths surge by more than 500 a week since pandemic. Experts say Britain is in the grip of a heart and stroke care emergency due to NHS, that's National Health Service, disruptions in care and increasing ambulance delays. 500 a week. Think about that number. 500 more people dying every week in a relatively small country. And the authorities immediately are blaming pressure on the health service. But let's dive into this story a little bit more. Heart deaths have risen by more than 500 a week, major research has shown, with experts saying extreme disruption to the health service caused by the pandemic may have fueled the crisis. The study of government data revealed almost 100,000 extra deaths among people with heart disease since the spring of 2020. The British Heart Foundation analysis of data from the government's Office for Health Improvement and Disparities revealed an extra 96,540 deaths of patients with heart conditions since February 2020, while excess cardiovascular deaths in the first year of the pandemic were linked to the virus. Heart deaths have remained high since pandemic virus deaths have fallen. So that's an important point to remember. Heart deaths have remained high even though deaths from the virus have fallen. Let's go to the actual source of the data. As always, don't ever just look at a headline, no matter what mainstream media publication it is. Always go to the actual source of the data. So let's do that here. So here we have it from the British Heart Foundation website. Nearly 100,000 more deaths involving heart conditions and stroke than usual since the pandemic began. So it is confirmed here, that number, almost 100,000. And they calculated that on average there have been over 500 additional deaths a week involving cardiovascular disease since the pandemic began. And they say here that in the first year of the pandemic, the viral infection drove high numbers of excess deaths involving cardiovascular disease. But while deaths from the virus have since fallen year on year, the number of deaths involving cardiovascular disease have remained high above expected levels. I will share the link with this article with you down below, but the authorities here again seem to mainly be blaming the health service and the pressures put on the health service. They talk about people waiting for cardiac care being at record levels, and they do put some blame on the virus itself. Experts weighing here, including the president of the British Cardiovascular Society. Those are awful statistics, absolutely abysmal, and I don't think the medical establishment is taking this anywhere nearly as seriously as it should, and you can bet your bottom dollar. In fact, we've already seen this. Countries which do keep accurate data are releasing a very similar picture in terms of statistics. Unfortunately, in the United States, we don't have accurate data, we don't have public data like this released across the country, so something like this will happen under the radar. So rather than focus on why this is specifically happening, which I've covered in previous videos, I want to talk about what you and your family member can do specifically to avoid becoming one of these statistics. And the first thing I would like to say, obviously as a doctor who specializes in metabolic health and lifestyle medicine, be as healthy as possible. I've said it many times before and I'll say it again, stay away from the ultra-processed junk, rubbish food, high in sugars, other fake ingredients. Be as physically active as possible and do everything you can to make the right choices every single day. And following on from that, be very careful with everything you put into your body. Make sure that nothing goes into your body which potentially increases cardiac risk. Then, it must be said, if you have risk factors especially, go get checked out. Now, you all know from watching my videos that I'm very skeptical of our healthcare and medical system. For want of a better word, I think huge swathes of our medical establishment are a complete and utter scam. However, one thing we do very well that I'm very proud to be part of when I'm not practicing outpatient metabolic health, lifestyle medicine, I do work in acute care. And I think that we fix acute problems very quickly and we're very good at recognizing problems quickly through the right testing. And I would urge anyone out there, if you have any worrisome risk factors, go get checked out. Go to your doctor or any other medical facility in your area that offers these tests. Get an EKG, an electrocardiogram. Get some baseline blood tests, including a complete blood count. Make sure you're not anemic. Get a complete metabolic panel, including renal and liver function. Get your blood glucose measured over time. That's a test called HbA1c. Get a HOMA-IR, homeostatic model assessment for insulin resistance. I made a video on that before. Get your cholesterol panel measured. Get a vitamin D level. All of these crucial metabolic health markers, get them checked. And if there's any other additional concerns, you can have more tests, including an echocardiogram, a heart ultrasound, or even a coronary artery calcium CT scan, which is getting done in more places now to look at how much calcium may be deposited in your cardiac arteries. All of these tests will give you some more indication about your risk factors. Finally, it must also be said, goes without saying, if you're having any symptoms whatsoever, then go and seek help. There are so many people I see, so many patients I meet, who I will delve into the history, and they tell me that they've been having symptoms for months, sometimes years, and the problem wasn't nipped in the bud. So if you have any chest discomfort, any chest pain, often radiating to the jaw or the left arm, or you notice any unusual increasing shortness of breath, tiredness, palpitations, then those are warning signs. Those are red flag signs that you should be checked out. So that would be my advice, Dr. Dhand's advice, to avoid becoming a statistic. Remember that advice, pass it on to any family members, friends, loved ones. It's important to remember that. Do everything possible to avoid becoming one of those statistics. We can only do our best. There's never any guarantees in life. Before I finish, I would like to share with you a clip, seeing as we're talking about the United Kingdom, of the ex-United Kingdom Health Secretary during the pandemic, talking about his regrets. He just made this statement during a public inquiry into the pandemic which is taking place in the UK. Take a listen to this.
And if I may say so, I am profoundly sorry for the impact that had. I'm profoundly sorry for each death that has occurred. And I also understand why for some it will be hard to take that apology from me. I understand that. I get it. But it is honest and heartfelt. And I'm not very good at talking about my emotions and how I feel. But that is honest and true. And all I can do is ensure that this inquiry gets to the bottom of it, and that for the future we learn the right lessons so that we stop a pandemic in its tracks much, much earlier, and that we have the systems in place ready to do that, because I'm worried that they're being dismantled as we speak.
So you got that? That is what Matt Hancock said. He was one of the primary people who led the United Kingdom's disastrous pandemic response. The extreme lockdowns, way more than anything in the United States. People were basically confined to their homes for months, and we've seen all the unfolding catastrophic health consequences from that. But that is what Matt Hancock said there, that he thinks we should have been even more strict. Isn't that what he was suggesting there? And in fact, that's what the headlines are saying today, that we should prepare for harder lockdowns in the future if needed, during a future pandemic. Heaven help us. Matt Hancock, like a lot of the leaders all across the world who led this disaster over the last 3 years, 2020, 2021, are complete clowns. Let me be very blunt with you indeed. They have caused so much damage. And isn't it disheartening to know they have learnt nothing whatsoever? They would do it all again, but even more strict. A word about Matt Hancock in particular. Those of you in the United Kingdom already know this. He is an extreme hypocrite. He didn't even abide by his own lockdown rules. He was gallivanting around. For goodness sake, he was having an extramarital affair the whole time that was well publicised. Then, after he left his position, rather than fade off into the sunset in shame, he went on to appear on reality TV shows, including I'm a Celebrity. That is the standard of leader we have across the Western world. Not just in the UK, but we have these clowns here in America and other countries as well. What a disaster. clearly learnt nothing whatsoever. So heaven forbid the next pandemic comes along, it may be even worse. Watch this space, stay on your guard, and hold these leaders to account. Thanks everyone for listening. Let me know your thoughts. Feel free to comment on this video. Check out my online course and my Uncensored platform. Those links are down below. My goal as a physician is to keep my patients away from medicines, if at all possible. And I want that for everybody, to be as healthy as possible. Try your best, make the right decisions every single day to stay away from mainstream medicine, doctors, and the medical industrial complex. Hit the like button if you like this video and the bell button for more similar videos in the future. We will talk again very soon.